where mental health meets real life. I'm your host, Samantha Ariza, therapist, educator, and a semi-normal human being. But overall, I want to be your go-to person for real, relatable conversations about healing, growth, and emotional wellness. That includes mental health wellness, if you didn't know. Around here, we believe mental health doesn't have to be stiff or scary. We keep it human, practical, and have a little bit of fun along the way because, hey, life gets messy. We're all just trying to figure it out, and here's a safe place to do it. Each week, you'll get honest insights, science-backed tools, and stories that remind you you're not alone. Whether you're on your own healing journey or supporting someone else, there's something here for you. So take a breath, grab a cup of coffee, just get some comfiness going, and let's dive in. As you know, we've been digging into mental health myths, truths, and hot takes. A lot of them make us pause and go, wait, is that actually true? And that's kind of something that we're going to deal with today in today's hot take. And it's a big one because it says access to therapy is a privilege, not a right. And at first glance, that might sound very cynical, but let's be honest, it sounds true. Because if we look around, even in 2025, therapy isn't as accessible as it could be. Not by a long shot, to be honest. And in today's episode, we're unpacking what it means to say that therapy is a privilege and not a right. And more importantly, what needs to change so healing isn't something that you have to afford or even earn. So today we're going to cover the very real barriers that make therapy inaccessible, what peer-reviewed research says about who gets left behind, and why this isn't just a glitch. It's a feature of the system we're in right now, sadly. Finally, what it might look like to reimagine therapy as a basic human right. So let's get into it. Let's start with a story that has become way too common. I can't tell you how many times, I've been on social media or anywhere, and I hear the same story. It's something that happens all the time now. Someone finally gets the courage to seek therapy. They're like, okay, I'm gonna do it. So they hop online, they search for providers, maybe they even call a few. And then boom, they hear these responses. I don't take your insurance, I'm full for the next 6 months, or even I don't have any availability. The next one is my fee is $180 per session, but I do offer a sliding scale starting at $140. And just like that, the door is closed. Again, because therapy is often portrayed as this universal solution. Everyone should go to therapy. And yes, totally believe that. Do not get discouraged with that. But the truth is, everyone isn't able to. And that means we're telling people to get help in a system that's not built to help them. So let's talk about why therapy isn't accessible and why it's starting to feel very much like a privilege. And it always starts with cost. Let's be real. Finances are a huge thing, and we can't neglect or even ignore the fact that money plays an issue in this whole problem. A 2022 survey by Verywell Mind found that nearly half of people already in therapy worried about whether they could afford to stay in it. Many had already skipped sessions due to cost, and that's just those who got in the door. For many others, the numbers don't even make sense. Because when we see therapy, at least in numbers, therapy can range from $100 to $250 per session. And insurance doesn't always cover it. And when it does, sometimes therapists are out of network. Then we have copays, deductibles, and session limits. There are so many things that come into the financial aspect of therapy that it's kind of overwhelming. Sometimes I even get friends who are like, hey, can you explain this insurance thing for me? Or I know even on my end with certain insurance companies, as I'm billing, it'll tell me how many sessions my client has left for the year. Not just the month, not just the week, the year. They've already planned it out. A report by Center for American Progress found that mental health providers are paid significantly less by insurance than physical health providers, which leads many therapists to avoid joining networks, and that pushes the client's cost onto them. So even with insurance, many people still cannot afford care. And let's not even get into the fact about trying to get into insurance companies. I know I may have said this in the past episode about my struggle with getting credentialed with insurance companies. It's such a process, man. And even if you think you've done everything, sometimes you haven't. And sometimes it can take 7 months or a year or even more to get credentialed with insurance companies. Not that this is on the fault of the therapist. It's just a fact that happens in the system. To get credentialed with insurance companies is a hassle and a half. So even if a therapist wants to take insurance in order to provide services to more people, this might not happen within their first year of practice. But even geography plays a part in this whole therapy access thing. Because as of 2021, over 129 million people in the US lived in areas designated as mental health professional shortage areas by the federal government. So even if you can pay, if you live in a rural community or a smaller city with fewer providers, you might not find anyone available. And let's even talk about other countries. There was a study in Germany where healthcare is more accessible. They found that even there, people from lower educational and occupational backgrounds used therapy far less, despite their fewer financial barriers. And that tells us something else is going on. We've talked about stigma, lack of awareness, maybe even a cultural mismatch. It's simply not feeling like therapy is for people like me. And if we go back even to season 1, we have a whole episode about stigma and why stigma plays such a big part in preventing people from getting therapy. And let's break it down even more with actual data. Let's talk about kids and teens. In a 2024 study of nearly 7,000 children with anxiety or depression, over 50% of caregivers said accessing therapy was somewhat difficult, very difficult, or impossible. And the biggest predictor of access? Consistent insurance coverage. How about low-income adults? A recent paper in Frontiers in Public Health found that low-income individuals face barriers across the board: cost, lack of nearby providers, transportation issues, and long wait lists. Even public mental health systems are overwhelmed. A quote that stood out to me from the study said, "Low-income populations often face the paradox of needing care the most, yet accessing it the least." And let's talk about Black, Indigenous, and people of color. Data shows that among adults with poor mental health, we saw that 50% of white adults got care, but only 39% of Black adults and just 36% of Hispanic adults received services. Barriers included cost, mistrust, difficulty finding cultural competent therapists, and of course, stigma. So yeah, the data paints a clear picture. If you're lower income, uninsured, non-white, or live outside of a major city, your chances of accessing therapy drop drastically. And that's not your fault. That's the system itself. So why wasn't the system built for equity? This is where it gets structural. Mental health care wasn't built to be universal. It was built within systems of insurance companies that profit from scarcity, workforce pipelines that exclude diverse voices, public funding that's been gutted for decades, and clinical models that center on white Western norms. Here at Ariza Inspire Co., we want to make sure that we are able to give tools to everyone who needs it. You have been hearing about my Resilience X 6-week workshop on resilience. However, I've decided that we are going to do kind of like mini workshops now. I have decided that we are going to do 30-minute skill-based resilience workshops, one-offs that kind of takes some of the skills from the Resilience X program and curriculum, but condenses it and kind of gives you like that quick tip to help you get to where you want to be. Resilience is that ability to bounce back and get back on track. And sometimes our resilience can, falter. So I want you to take the opportunity to sign up for these 30-minute resilience skill workshops. You'll see some of the dates over here. You will find the link in the bio, but the spaces are limited. I don't want this to be a huge thing. I want to still be able to help people in this kind of small group setting. So don't waste time today. See if you can hop on to the next one coming up soon. Even when we talk about mental health parity laws that, are supposed to make insurers treat mental health like physical health, they are often not enforced, meaning they make the laws but don't make sure that they're happening. So providers get paid less, coverage is more limited, and networks are super narrow. And what does that mean? What happens because of this? Therapists burn out, and then they stop taking insurances. Clinics underpay staff or completely shut down, and people fall through the cracks. Because if help is hidden behind barriers that only privilege can unlock, then that means they don't have the key. And it's such a hard thing. Being a therapist, I see both sides. I see the people who are hurting who need my help. And then I look at my finances and I'm like, how do I do this? And it's just a constant struggle. And instead of the struggle being on the people who can make the actual change, like the government, insurance companies, the people who can actually do something about it, it's on the provider. It's on the smaller people who actually have to deal face to face. And it sucks because it's not the therapist's fault. It's not the person's fault. It just ends up being such a tug of war, and we don't have anybody to blame except those who are in charge of the system. But let's dream for a second. What would it take to make therapy a right and not a privilege? Here's some things, and here's what it could look like. We would have public funding for community mental health, kind of like how we fund public schools and libraries, except better because we know they also do not get the funding they need. We would see telehealth access for rural and underserved areas. There would be sliding scales in place or free options built into systems, not left to charity and not at the therapist's expense. We would see culturally responsive care, therapists who speak your language, understand your identity, and reflect your community. We would see training and recruiting of therapists from underrepresented backgrounds. And of course, we would see better insurance reimbursement rates. So therapists would want to stay in network. But beyond policy, it starts with belief that healing shouldn't be something you earn with money or access. It should be something you deserve, and you should get just because you're a human. But we also need to be careful then with our language, because phrases like just go to therapy, while well-intentioned, can feel tone deaf to people who have tried and hit every wall. So instead of that, what if we said, I hope you have access to support, and if not, let's talk about options. Therapy should be for everyone, but I know it's not, and that's not okay. How about let's fight for a world where healing isn't a luxury and people can get the support and access to healthcare like they're supposed to? Because mental health care shouldn't be a reward. It should be a right. So if you've ever felt like therapy was out of reach financially, geographically, culturally, I want you to hear this. You're not alone. It's not in your head. It's in the system. But also your healing still matters. Your mental health still is important because you deserve care that fits your life, your story, your needs. And those of us who do have access, it's on us to speak up, to advocate for systems that don't gatekeep healing. But no one should have to fight. No one should have to fight to feel better. But that's it for today's episode. Thanks for hanging out with me. If you found something helpful, inspiring, and even just validating, I'd love it if you'd follow the show, leave a review, and share this episode with someone who might need it. Do you want more tools to support your mental wellness journey, your mental health journey? Just head over to arizainspire.com. You'll find free resources, courses, workbooks, things that are there to help you heal, grow, and of course, to show up for yourself. Don't forget, though, to follow us on Instagram, TikTok, Facebook at Ariza Inspire Co., because that's where we keep these conversations going. I share mental health tips, and I post about new episodes, and sometimes I'm a little embarrassing. I show a little too much of my life, but I want to make sure that you know, hey, we're all going through it sometimes. So take care of yourself, my friends, and I'll catch you next time. Can't wait for next week? Here's a sneak peek of the next episode on the Ariza Inspire podcast. That setting boundaries is selfish. And maybe you've heard it. Maybe you felt it. Maybe you've even said it yourself. But let's be real. When someone tells us, I can't do that for you, or I need space, or that doesn't work for me, it can sting. But does that make it selfish?